Hi, my name is Ella. I'm going to begin by doing my head-to-toe assessment. I'm just going to scan the room. So I'm going to begin by doing my hand hygiene and putting on my gloves. And then I'm going to go ahead and clean my stethoscope, the bell, and the diaphragm with an alcohol swab. Hi, my name is Ella. I'm going to be your student nurse. Today we're going to be doing a head-to-toe assessment. Can I get your first and last name?
William Overton.
And your date of birth?
1932.
Okay. Are you comfortable?
Yes.
Do you have to use the washroom?
No.
Okay, I'm going to ensure patient privacy, and we're going to begin. So first, I'm just going to conduct my general survey. So my patient's skin is consistent with his age or his race, and there's no notable body odor. My patient, if you could stand. Okay, thank you. My patient's height is consistent with age and gender, and the upper and lower extremities are symmetrical. The posture is upright, the head is erect, and there's no notable physical deformities. My patient has a normal facial expression. There's no abnormalities. He's in a good mood. There's no slurring of speech. He's dressed accordingly to the weather, and he's maintaining eye contact throughout the assessment. So can you tell me what day it is? What year it is?
2024.
And who are you?
William Overton.
And where are you?
The hospital.
So my patient is alert and oriented ×3, and his work of breathing is silent and relaxed. I'm going to go ahead and continue to do my head assessment. So I'm just looking for symmetry, asymmetry, any masses, lesions, the color of the scalp, any scars. So my patient's head is symmetrical. There's no noticeable physical deformities or protrusions. And we're going to go ahead and test my patient's cranial facial nerve. So can you close your eyes tight? Okay, keep them closed. I'm going to try and open them with resistance. Okay, can you smile? Can you smile with teeth? Can you frown? Can you puff out your cheeks? Okay, keep them puffed. I'm going to try and deflate them. Okay, so my patient's facial cranial nerve is intact. And we're going to go ahead and move on to our eye assessment. So I'm going to be looking at the eyebrows, eyelashes, conjunctiva, sclera, and the color. So the color of my patient's eyes are blue. The lash and hair distribution is evenly distributed between the lashes and the eyebrows. The sclera is white with noticeable pink blood vessels, which is not abnormal. I'm going to go ahead and check my patient's conjunctiva. So they're just pink with noticeable blood vessels. I'm going to go ahead and test my patient's ocular motor cranial nerve. So I'm going to be testing with consensual and direct and consensual light. I'm going to begin by measuring my patient's pupils. It's about 3 centimeters on both sides. And I'm going to go ahead and do my direct and consensual light. Just look straight ahead. So direct, consensual, direct, consensual. So my patient's pupils are constricting, which is indicating that my patient's cranial nerve, the ocular motor nerve, is intact. My patient's eyes are symmetrical, and there's no protosis, laid leg, no discharge, or crusting. Next, we're going to go ahead and do the ear assessment. So I'm just looking at the symmetry. They're symmetrical on both sides. There's cerumen noted. There's no discharge or crusting. We're going to go ahead and do the nose and the sinus assessment. So I'm just looking for the patency of his nostril. There's no flaring. The nose is midline. And I'm going to go ahead and do the mouth and pharyngeal assessment. So just starting with the lips, they are not blue in color. They're pink in color. There's no lesions or scars. And they're hydrated. I'm going to go ahead and check my patient's glossopharyngeal cranial nerve as well as the vagus nerve. I'm just going to get you to open your mouth and say ah. So we're looking for my patient's soft palate and uvula to rise, which it did. So my patient's vagus and glossopharyngeal nerve is intact. We're going to move on to the hypoglossal cranial nerve. So if you could just open your mouth. So the tongue is midline. Can you move it side to side? Can you say light, tight, dynamite?
Light, tight, dynamite.
So my patient is able to say the 3 words with no tremors, and therefore the hypoglossal cranial nerve is intact. And we're going to move on to the neck assessment. So I'm just going to inspect and palpate the neck. So I'm just looking for any scars, lesions, any abnormal pulsations. The cervical muscles are symmetrical, and I'm going to go ahead and palpate. There's no obvious enlargement of the thyroid. Is there any pain?
No.
I'm going to go ahead and palpate my patient's trachea. The trachea is midline. And I'm going to go ahead and palpate my patient's carotid arteries, which is at the border of the cartilage of the thyroid. Okay. So +2, the rate is, or the rhythm is regular. There's no obvious pulsations. So next, I'm going to test my patient's spinal accessory nerve. Can I just get you to shrug your shoulders? I'm going to just apply some resistance. Okay, so my patient's spinal accessory nerve is intact. And we're going to go ahead to the musculoskeletal assessment. So just beginning with the upper extremities, I'm just looking for symmetry, any visible masses or lesions. Next, we'll palpate. So the shoulders are symmetrical. They're the same. The arms are the same length. The temperature is warm to touch on both arms. And I'm going to go ahead and palpate. Any pain?
No.
Feeling for swelling, tenderness, edema, any joint inflammation. Okay, I'm going to go ahead and take my patient's radial pulse as well. So I'm just going to feel both of them. So they're equal bilaterally. About a +2, the rhythm or the rate is regular, and I'm going to go ahead and take the rate for 30 seconds. Okay, so my patient, his pulse is bounding +2. They're equal bilaterally, and the rate is 68 beats per minute. And I'm going to go ahead and do the lower extremity. Oh, actually, can I grab you to just squeeze my hands? Okay, so my patient has a tight grip and is able to grip my hands without any tremors, and it's symmetrical bilaterally. So now I'm going to go ahead and explore the lower extremities. So I'm just first going to look for scars, lesions, any swelling, edema, joint inflammation, the color as well as the temperature. So just checking the temperature with the dorsal sides of my hands. It's warm to the touch. The same temperature as the upper extremities. I'm going to go ahead and palpate, looking for swelling, edema, fluid, joint tenderness, or inflammation. Any pain?
No.
I'm going to go ahead and do the right leg. Any pain?
No.
Okay, so my patient doesn't have any pain. And we're going to go ahead to the lungs and thoracic assessment. So I'm just going to first inspect my patient's chest wall and cavity. So I'm not seeing any visible lesions. The contour is both symmetrical on both sides. Can you take a deep breath for me? The chest rise is equal, and I'm going to go ahead and just palpate. Take a deep breath. So the lungs, they expand symmetrically. Any pain?
No.
There's no pain. I'm not feeling any swelling, tenderness, masses or lesions. So I'm going to go ahead and listen to all 12 of my patient's posterior thorax. If you could just move your hair. Thank you. Breathe in. Breathe out. 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 Just 2 more. Breathe in. Breathe out. Breathe in. Breathe out. Okay, so my patient has no crackles, fluid, or wheezing noted. Was there any pain when you were breathing in or out?
No.
There's no pain. I'm going to go ahead and assess the apex of my patient's heart, which is just located at the mitral valve. So to landmark, just landmarking the sternal notch, following the clavicle about clavicular midline, and following about 5 intercostal spaces down. So just about here. And I'm going to go ahead and listen for 30 seconds. So my patient's heart rate is about 68 beats per minute, just as it was on the radial pulse. It is +2 strong. The rhythm was regular. I'm not hearing any swooshing or murmurs. The sounds were present on S1 and S2, but they were not present in S3 and S4. And I'm going to go ahead and do the abdomen assessment. If I could just have you lie down. And I'm just going to put this pillow under your legs. Perfect. And I'm going to drape the patient accordingly. And I'm going to go ahead and inspect my patient's abdomen. So I'm looking for contour, lesions, masks, scarring. I'm not seeing any scarring. The contour symmetrical on both sides. It is flat. And I'm going to go ahead and palpate all 4 quadrants. Let me know if you have any pain. I'm feeling for any pain, tenderness, swelling, edema. Any pain?
No.
Okay, so no swelling, tenderness. And I'm going to go ahead and listen to all 4 quadrants as well. So I'm going to start with the right lower quadrant. The right upper. The left upper. The right or the left lower. Okay, so I'm hearing high-pitched gurgling sounds, which is not abnormal, as no sounds, no high-pitched gurgling may indicate a bowel obstruction. That concludes my head-to-toe assessment.